is Andrew Green, PN student, and today I'm going to be demonstrating sending a clean catch sample to lab, inserting a catheter, irrigating a catheter, and then removing a catheter as well. So right now I'm in my med room and I'm just going to do my hand hygiene. As I see, I have an order for a clean catch urinalysis, and it's for patient Lee Coast, 54 years old, date of birth 5/14/64, and I do have my labels here, so I'll just confirm that matches my provider's orders before I go in and retrieve that sample from my patient. So I have Lee Coast, 54 years old, Lee Coast, 54 years old, date of birth 5/14/64, 5/14/64. So I know my labels match my healthcare provider orders, so I'm just gonna make my way into my patient's room, as I've already been in there and asked him to urinate into the urinal for me. Hi Lee, I'm Andrew and I'm your nurse today, and I've already been in here and I asked you to urinate into the urinal for me. Were you able to do so? You were, okay, and it's just in the bathroom? Okay, I'll grab that. I've already confirmed before I got the sample. I'm just gonna confirm one more time with my provider's order and my labels. So I have Lee Coast, 54, date of birth of 5/14/64, and that matches my healthcare provider's order. And it also matches my labels. So I can go into the bathroom and retrieve that sample. So I don gloves as I'm dealing with urine. So I have like the urinal here, and then I have my cup and my biohazard bag. So before I would collect the urine, I'm just going to write the date. It is 10/30/19, and I'll write the time in a minute. I forgot to say that when I had asked the patient to urinate, he cleaned 3 times with a wipe, and he started to urinate into the toilet, stopped his stream, then began to urinate into the urinal, stopped his stream again, and finished into the toilet. And that would be the clean catch. So now that I have it, I've collected it at 10:20 a.m., so 10:20, and I would initial it. So that's done, and I would make sure I have my gloves on for when I pour that in, and I would label this on the bottle, so then the lids can't get mixed up. So I'm just gonna move this out of the way and this out of the way for right now. So I would pour this in, make sure the cup is staying clean, and I would screw the top back on, and then I would put it into my biohazard bag and seal it. And it's been labeled, dated, the time on it, and my initials, so my CNA will take it to lab for me. So I'm just going to move this stuff out of the way, as that has now gone to lab, and I can remove my gloves. So now I have an order for Lee Coast, again, date of birth 5/14/64, to insert an indwelling catheter after his clean catch urinalysis. So I've sent his urinalysis to lab. So now I can start with inserting a catheter. So I'm going to make my way to his room, knock, close the door, provide privacy of course, and greet my patient. Hi Lee, so I'm back after getting your urinalysis, and we have an order now to insert an indwelling catheter. So I'm just going to make sure I have the right patient again. So I have Lee Coast, 54, date of birth 5/14/64, 5/14/64. So I know I have the correct patient. I've done my hand hygiene, and now I can start inserting the catheters. So Lee, we're going to insert a catheter. It is going to be uncomfortable. I'll teach you some breathing techniques to get through the process. And just before I start, I'm going to clean your peri area. So if he was still clean from his clean catch urinalysis, then we wouldn't necessarily have to do this, but we're going to say that he had to go to the bathroom again after he provided the sample, so we're just going to clean it again. So I would normally have like a basin with nothing in it, just water, but to keep from clutter, I'm going to just leave my stuff in it for now. So I'm just going to put this waterproof chuck underneath you. Okay, and I'm just going to expose the patient now so you can see what I'm doing. Normally we would have 2 blankets, one covering the lower legs and one covering the torso area to only expose what we were working with, but for visual purposes we're just going to roll this down. So I would have my my washcloth with warm soapy water, soap that's, if it would be soap that's meant for genitals if I did have soap, and I would wash around the penis, and then I would dry. Okay. I'm just going to set these out of my way. And then I would take off my gloves, and I don't need any of this for right now. Okay, Lee. So he's clean, so I'm just going to leave him exposed so I don't dirty the area for right now. I'm going to open my catheter kit, making sure to keep sterile. Done my hand hygiene already after I've washed the peri area. And I would converse with my patient while I'm doing this, making sure he's comfortable, explaining the procedure, and answering any questions that he may have. So I would just take this out. And before I go any further, I'm going to turn this into a garbage bin at the foot of the bed. And because we don't have a footboard, I'm just going to put this at the bottom here and put this here so it kind of holds this as a garbage bag, and hopefully that stays. So again, my hands are clean, I've done hand hygiene, so I'm just going to move this. I'm going to open my catheter kit to remain sterile. I'm going to open away from me. I'm just going to move that out of the way. I'm going to go away from me, and then I'm going to go to the side, only touching the outer 1 inch. And then on the other side, making sure that it's pulled flat so it doesn't come back. And then I'm going to pull this down on the back side so I'm not touching that. So when it flew back, like when it went back, I had not touched that inside part. And then just make sure it's straight. And I'll just rotate it. And I'll take out my sterile gloves. And then I will put on another pair of gloves because I'm going to put this pad underneath him, and I just don't want to risk contact with his genitals on my bare skin. So remaining sterile though, I would pick this up, and then I would just place it underneath him as an extra protectant of the bed from any liquids. And I forgot to mention that I would have them in a supine position, which they're already in, and raise the bed to a working height, which I've done before starting this video because I'm tall and it's a stretcher and it takes a long time to move up. So my hands are clean. So now I can start with my gloves after I throw this away because I'm not going to use the triangle piece. So now I will just open my gloves. Making sure not to touch the gloves inside and only the outside wrapper. I'm just going to turn them this way. Okay, so I made sure not to touch my gloves. I'm going to start putting on my dominant hand, so I'm just going to grab it on the cuff, making sure not to touch the outside part. And then just working onto my hand, making sure not to touch the outside of the glove while I pull it down. And then I can start with my second pair. So this is sterile. So I will, I'm just going to turn this around for me. And I can grab underneath like this cuff, and then work my hand in. Making sure not to touch my skin with my clean glove, my sterile glove. So now that that is done, I can throw this away, making sure not to break my sterile field. And now that I'm sterile, I'm just going to adjust this box so then I can start getting my catheter ready. So first I'm going to start by putting the syringe onto my catheter. So I'll just start by breaking this open and then trying to pull it off. And then I can throw this in the garbage, making sure I don't break my sterile field. And then I can insert my syringe into the port here so I can inflate the balloon easier. And I can also throw this cap away. So now that that is ready to go, I'm going to open this package and I'm going to clean the penis 3 times with 3 different swabs in circular motions. I'll grab one, and then just maintaining my sterile field. So now I will grab the penis, and now I can only work with one hand. So I'll put this, I'll have a firm grip, and I'll clean in circular motions. And then I will grab another one. And clean in circular motions. And one more time, I will clean in circular motions around the urethra and the head of the penis. Okay, so now that that is done, before I continue, I'm going to have my camera person come and spray some lube into my tray so I can lubricate my catheter. So I'm just going to move this box out of the way for her. And just if you could spray it right there. And I might need a little bit more. Just want to spray it onto the end. And for a male, you need it lubed further than for a female because they have a longer urethra. So now that that is lubed, I'm going to move my box to beside, just underneath my patient so it's easier for insertion. So I still have not broken sterile field by not moving this one hand, so now I can start inserting. So I'm going to tell my patient, okay Lee, so I started inserting, so just take some deep breaths and pretend like you're blowing out through a straw. And I know it's a little bit uncomfortable, but keep doing those deep breathing. Okay, and for a male, typically, the catheter is going to go almost to this junction here. So now that that is inserted, I can move this hand and just hold it in place while I inflate the balloon. And I would just go at like a moderately slow rate, but okay, so now that is inserted, I will take my syringe off. And I am just going to keep this because I'll need it later for when I deflate the balloon. And it will probably fall out a little bit, which is okay. So now I no longer need to be sterile. So I'm going to grab my tape. I'm going to tape it to the patient's leg right away. And I forgot to mention, sorry, that I had seen urine, so I had progressed another 1 to 2 inches into the bladder. So I'm just going to tape this at the leg, about at the junction, but I want to make sure that this port is facing upward, not only so it doesn't irritate the leg, but so it also is easy for access for when we irrigate or deflate the balloon. So I'm just going to clean up this workstation quickly. And then I would hook it to the bed, and I do see urine coming out, which is a good thing. So I'm just going to hook it to the bed, and I wouldn't hook it to the frame. I wouldn't hook it to the side rails. I would hook it more to the frame so it moves with the patient when they go up and down in bed. So that is taped on to secure. Normally would have a securing device. So I'm just going to get rid of this. And I would clean up around the penis with water or wipes, any extra betadine. Okay, so now that the catheter is in, I would remove my gloves. I would make sure that my patient is in a comfortable position and that he's not too uncomfortable from the process. And then I ask me questions, do hand hygiene, clean up my workstation, and I would go and document how the patient tolerated it, the time I inserted the catheter, and exactly what I did throughout the procedure. And I would cover them back up and leave them in a comfortable position. I'm not going to take this chuck out as we're going to go right into irrigation. So I'm just going to leave it there for right now. So I would do my hand hygiene, and now I'm back in my med room, and I see that I have an order for Lee Coast, date of birth 5/14/64, and it's to irrigate the catheter with 30 milliliters of normal saline, PRN. And he does have a clogged catheter. I've already been in to make sure that the tubes weren't kinked. So we're going to irrigate his catheter and hopefully get whatever is clogging it, whether it's a blood clot or just some mucus, to pass through. So I have all my my stuff for irrigation. I have my unopened irrigation tray. So I'm just going to put some gloves on. And I would enter the patient's room. I've done my hand hygiene, knock, provide privacy. And then I would converse with the patient and confirm that it is the correct patient. So, hi Lee, can I get you to confirm your name and date of birth for me? Lee Coast, 54, okay, and your date of birth is 5/14/64. Okay, and that matches my healthcare provider's order, so I know I have the right patient that I'm going to be irrigating the catheter for. So Lee, we have an order to irrigate your catheter as it isn't draining properly. So we're going to go ahead with that. Yeah, your bladder feels pretty full. Okay, we'll get that irrigated. So I'm going to take out my irrigation, and I don't need this. I'm just going to put it back in here. And then I would pour my normal saline into this tube. And then I would grab my syringe and my needle, and I would just twist it on. And before I continue, I'm just going to move this out of the way. And before I continue, I'm going to wipe down the port. So Lee, what's going to happen is I'm going to clamp your tubing, and then I'm going to put some, we're just going to adjust your tubing here. So I'm going to clamp your tubing, and I'm going to put some normal saline into it to help irrigate your bladder. So I would clean the port for about 30 seconds. And then I can go ahead and put my syringe in there and withdraw my liquid. Okay, so I would have my 30 milliliters, and then I would insert it into the port. Before that, so I would actually go and get a new syringe because I have done this wrong. So I'm just going to start over with this skill. So I actually need to clamp my tubing, and I'm going to take that needle tip off, and I would have a new syringe. So let me just clamp this quick. Okay, so I'm clamping your tubing. Okay, so that's clamped. And I'll clean this again. Okay, so I started over before I inserted any of the normal saline, as I realized that I had made a mistake. So we're okay to continue. So I'm just gonna take this needle tip off and throw it into the sharps container. I would re-pour into a new irrigation kit, and before I even put the needle on, I would withdraw my liquid. So I'd withdraw my liquid, 30 milliliters. Okay, and now I can put my needle tip on. And my tubing is now clamped, and I have my new syringe, my new needle end, so everything is sterile. So I can go ahead with inserting, and I've already cleaned this. So I'll just put this into the tubing. It's clamped, and I can insert the liquid, and I can see the liquid going up into it. Okay. So now that that is all inserted, I will do the scoop to recap, since this was not in a bodily area, it was just in the catheter thing. So I would unscrew. This would be disposed of. This would go in the needle sharps. And then I would wait the amount of time it needed to sit in the bladder, if it was medication. And if it's already been all into the bladder, then I can unclamp. And then I will see liquid starting to go down, and I can see lots of clots coming, which is a good thing. It means it's irrigating the bladder. So then I would do my hand hygiene, remove my gloves, clean up my workstation, make sure my patient is in a comfortable position, ask them if they need anything, and then I would go to document my procedure in my irrigating, that I clamped, that I had to get a new syringe and a new needle as I made an error before I had started. I would clean the port again before I leave, and make sure the patient is comfortable, and go document. So now it's a new day, and I'm back in my bedroom, and I've done my hand hygiene, and I see I have a new order for Lee Coast. His date of birth is 5/14/64, and it is to discontinue his indwelling catheter. So I will go into my patient's room, and I've left this chuck under him for irrigation purposes and now for catheter removal. So I will go into his room, I'll knock, provide privacy, greet my patient. So, hi Lee, I'm Andrew, I'm your nurse today. Can I just get you to confirm your name and date of birth for me? Lee Coast, okay, and your date of birth is 5/14/64. Okay, that matches the wristband and my healthcare provider orders, so I now have the correct patient. So today, Lee, we have an order to remove your catheter. So it is going to be uncomfortable again. So if we can just do those deep breathing techniques again, where you take deep breaths and blow out through a straw, and we'll get that removed for you. So I'm just going to don gloves. I've done my hand hygiene, and I kept my syringe from earlier because I knew I need it, but I technically have a new syringe. So I've done my hand hygiene. So I'll remove the securing device, and then I can put this into the port. And I will just, I'm just going to secure this, so make sure it doesn't like tug out while I'm deflating the balloon. So I'm going to pull back, and I still see liquid coming out, so I'm going to pull back until I can't anymore, and now I see air, and I'm pulled back as far as I can, so I know I have all the liquid. So now, okay Lee, take a deep breath and blow it through a straw. Good, and I'm just going to pull it out. So then I can wrap this end in the chuck. And because I didn't empty the bag before removing it, I would take it to the bathroom, and I would do my I&O, And something I forgot to mention while I was irrigating, I would have documented my output minus my irrigation amount, which was 30 milliliters. So now that I've removed it and it's a new day, I'm just going to calculate my output. I put it into a cylinder and then measure it, and then I can throw this away into the proper disposal per facility policy. I would clean up my patient, make sure he's comfortable, cover him back up, ask him if he has any questions, if he's in any discomfort, make sure the call bell is in place by him, make sure the side rail is up. Then I would remove my gloves, I do hand hygiene, and I would go back to my nurse's station and I would document removal of his catheter, how the patient tolerated it, and my procedure that I did now to conclude this video.